The Truther Girls.
Hi everyone, Truther Girl Sonia here. Well, San Diego has declared a health emergency, a state of emergency over a hepatitis outbreak. Earlier this month it was reported about 264 people had been hospitalized and 14 had died, and that death toll has now risen to 17 with no signs of slowing. So what's going on in San Diego? Well, first of all, it's important to point out that most of the people who are affected, that is 70 to 85% of the people who've been sick, who've been hospitalized, and who've died, these are homeless people. Hepatitis A can cause illness in anyone, but it can be deadly in people who have a compromised liver. So probably the reason the death toll is so high is that a lot of these homeless people, maybe they have existing liver disease or they're alcoholics. So they're trying to figure out what they can do. And what do you think is the first thing they did? Yeah, you guessed it. They rolled out the vaccines. They offered hepatitis A vaccines. And the problem was that it turned out that that didn't solve the problem. It didn't do anything, nothing really. So what they did after that was they started cleaning public areas with a mix of water and bleach and educating people to wash their hands. Because hepatitis A is spread by fecal oral contact, which means somebody goes to the bathroom and takes a dump and doesn't wash their hands and then handles food. And next thing you know, if that person who handled the food had hepatitis, whoever eats the food, they're probably going to get hepatitis too. So now, of course, the city is going to great lengths to try to educate people about how that spreads so they can keep their hands clean, because this is the most important thing. And you know, this is really a problem because you ever seen a homeless camp? It's pretty dirty, and on top of that, a lot of these people are using needles, like sharing needles. So you can imagine this is a really great environment for something like hepatitis to spread. So now the concern is this going to spread to LA? Well, just in case it does, LA has started to make preparations. So what do you think they're doing? Yep, they're vaccinating people. In Orange County, public health nurses are encouraging homeless people to get vaccinated through their primary medical care providers and administering vaccinations at shelter clinics, food pantries, and parks. More than 300 people have been vaccinated so far. Seriously, 300? That's not even going to make a dent. LA County public health officials said they have vaccinated more than 1,000 people to date. Yeah. That's not going to do it. You know, I want to bring up this study that was done in, I think it was in India and Pakistan. It was a hand washing study, and they found that just by getting people to wash their hands with plain soap and water, it decreased cases of gastro by 50% and pneumonia by 50%. And hepatitis too. Really, this is an issue of sanitation. I just want to take this opportunity to point out that some vaccine preventable diseases like this. Now, I'm not like a huge anti-vaxxer, get rid of all vaccines. If there was a rabid dog in my building and I got bitten, I'd probably be first in line to get a rabies shot. But in general, I think vaccines, they're kind of over-glorified and the risks are underplayed. And this is a good opportunity to kind of reflect on the fact that hygiene is way more important than vaccines. A lot of vaccine preventable diseases, even when you don't have a vaccine, they go down when hygiene improves. Anyway, LA County didn't, I guess, learn much from San Diego's experience where they found that the vaccines didn't work, because now they're vaccinating people in LA. Now, just one last thing. Some of the articles that were covering this epidemic kind of politicized it, and they made it about illegal aliens, because there are a lot of undocumented, what do you call them, migrants, immigrants, illegals, whatever, in California. And so they're saying, well, this is why you have this outbreak. California has more homeless people for some reason than anywhere else in the country. And so some people say, well, that's because you're letting in the Mexicans. But there's nothing proving that illegal immigrants are the reason there's so many homeless people, or that they're responsible for the hepatitis outbreak. There's no proof that it's because of that. I think it's way more related to just poverty and homelessness. That's the real issue. Watch. Outbreak of flesh-eating form of strep among homeless kills at least one man. This was here in Montreal. You get outbreaks of diseases in populations like the homeless who live in very unsanitary conditions. They're not exactly the cleanest people on the planet. No offense to homeless people, if there's any out there that are watching this, they're saying, well, I have impeccable hygiene and I'm homeless. I'm sure there are some people who just don't have a house and they keep clean, but a lot of people out there, you know, they don't have the opportunity to keep clean, or they don't have the wherewithal or whatever. So to me, this has a lot more to do with sanitation. And 1,200 Canadians bought berry mix linked to Hep A outbreak. A couple of years ago, there was a huge Hep A outbreak in Canada, and it was just linked to contaminated food. I don't think you can, you know, blame the Mexicans for that. And it was the same strain as a 2012 British Columbia outbreak, and they said that the strain of hepatitis A that the infections all had in common is genotype 1b, which is rarely found in the Americas but circulates in North Africa and the Middle East. Well, these berries came from Oregon or BC, and they were contaminated with a Hep A strain that comes from the Middle East. So, I mean, if you really want to put a spin on it, you can say, aha, it's because of the Arabs. But I don't really, you know, the disease doesn't really care where you came from. I mean, once it's out there, it's in the population, it's somewhere. All it takes is for someone who didn't have clean hands. Doesn't matter where they came from, what kind of documentation they have. All that matters is somebody who works in food service who had unclean hands, who contaminates people and gets it out there. And from there, what determines probably how easy it'll be to contain is what population does it get into. If it's homeless people, they're living in homeless camps, it's going to be tough. What are you going to do with these homeless people? See, that's a bigger problem. Why there's so many homeless people, and why they don't have access to facilities to keep themselves clean. And I'm saying that, I'm thinking, well, yeah, and then they go back to their filthy encampments. But I mean, that's part of a much larger problem. But I don't think it's fair to just blame it on, you know, Mexicans or whatever. I don't think it has anything to do with that. So I just want to give you a heads up. They're having this big problem with hepatitis A in California. If you don't have chronic liver disease, though, even if you get it, it probably won't put you in the hospital or make you very sick or kill you. And B, that the best thing to do is for everybody to just wash their hands. Just remember, cleanliness is next to godliness. And so that's it. I just want to give you a heads up. Let me know what you think, and thanks for giving me a thumbs up, and thanks for listening to me, and I'll see you next time.